My name is Murad Alam, and I'm a professor of dermatology as well as the director of cutaneous surgery at Northwestern University in Chicago. So I trained both for undergraduate and medical school at Yale, and then I completed a residency at Columbia University in New York, after which I did a fellowship in cosmetic dermatologic surgery in Boston, and then one also in Mohs micrographic surgery in Texas, in Houston. Now, the reason for the interest in this particular series has been the rapid evolution in minimally invasive cosmetic procedures that has come about in the last 10 years or so in dermatology. And that's really created a need for books that are up to date and practical and help people who are learning procedures step by step learn how to do them safely and effectively. And in particular, with this series, we wanted to stay away from giant tomes that covered everything from basic science to clinical applications and included every single procedure. So we have individual books that focus on the practical aspects of each procedure. Well, Dr. Dover actually was the person who trained me in Boston. So we've known each other since at least the beginning of my career, perhaps a little bit later in his career. And he was just an outstanding mentor during my training period. And I know, having tried to train others since then, how difficult it is to be a warm and supportive mentor to someone who's just learning something and encourage them and help them be good at something without being so hypercritical that they're sort of beaten down. So he was just the perfect mentor for me. And then when we finished up fellowship, we discussed the possibility of these slim volumes on specific topics to help people like myself, and that's how we got started. So in the new series, we have a revised volume on neurotoxins, botulinum toxin, as well as a revised volume on soft tissue augmentation. It's still the Carruthers editing it, but they are the world experts, and so we're very fortunate to have them stay on as editors. But they'll be bringing a lot of further detail. For instance, with the neurotoxins, we not only have Botox, but we have 2 new ones that have been approved since this series began, and there are subtle differences in how these are utilized. So it's very important to be all-inclusive and make sure the books stay up to date. And then for lasers, we previously had 2 separate volumes, Lasers 1 and Lasers 2, and we're combining them, which we think will be more value for the individual purchasing them, allow everything to be in one place, and also allow us to update all of the various devices that have come up since then. I think one exciting thing with the newer edition is that we're really trying to focus more on the digital content. So trying to make it easier for people to pull up the video, trying to make it easier for the video to be integrated seamlessly with the text, and also for the website that people can go to at Elsevier, expert consults, be more robust. So it's really bringing all kinds of additional information that is not available in a traditional print textbook. So all of these books come with videos, and the videos are keyed into specific chapters, and they're narrated by experts. And the utility of that is pretty obvious, but just to recap, even if you read the most clear description of a procedure, there's still a lot of ambiguity as to exactly how you hold the needle and how far you push and what it should look like when it's in action. So the video takes a lot of that mystery out, and you can get to see people who are expert injectors, for instance, doing the procedure, and you can model your own behavior on them. And it's also nice to hear the small tips and pearls about refining the procedure that are much more comprehensible when they occur in the context of observing the procedure. Well, I think it's been an absolute joy to work with Elsevier. There are many special things compared to other publishers that I've worked with, and one of them is the medical illustration, which is just outstandingly good. There's a whole division of people at Elsevier who can take a back-of-the-envelope scribble and render it into a professional, multicolored, and very clear medical illustration. And for books that are procedural, that are trying to show you step-by-step processes, that's really invaluable. Because no matter how good the photograph, sometimes it's impossible to show what you really want without having a schematic drawing. So that's one thing. And the other special aspect of these books is the turnaround time. So within 4 to 6 months from the time the text is in, the book is in our hands, and that ensures that we give a very up-to-date book to the people purchasing copies.